Welcome to Return on Insights, the show where candid conversations with bold founders and leaders spark actionable insights for your business. I'm David Lindover.
And I'm Erin Abitangelo. Each week, we pull back the curtain with leaders who are scaling teams and shaping the future, sharing the insights that create impact far beyond the bottom line.
Discover how high-performing companies build enduring cultures, inspire teams to think bigger, and turn vision into action. If you see storytelling as your strategic advantage, you're in the right place. Today, ServeRx co-founder Breck Rice joins us to share his story, from leading through industry upheavals and pandemic pivots to championing mission-critical innovation in a market dominated by giants. His journey is proof that adaptive leadership can make a real difference. Welcome, Breck.
Hey, it's nice to be here, David.
Your career shifted from BP merchandising to healthcare advocacy. What pivotal moment made you realize pharmacy preservation was your calling?
I think it was a little bit out of necessity. So, I started with American Oil, Amoco, and during that, they called it a merger, but in my alphabet, A comes before B, so I'm not sure why it was named BP Amoco until you see the writing on the wall, and it was actually an acquisition, right, not a merger. But during that time, I didn't have any budget because you have to go through all of the securities and exchange and antitrust and monopoly, everything was basically, all budgets were on hold. And so I was trying to run, merchandising for two territories with zero budget. And so it was a good opportunity to get look for a new job, and one landed in a fairly new startup technology company that was involved in healthcare that looked pretty exciting. So I was like, man, I've got to feed my family. Let's go do it.
Very good. So when we spoke, you talked to me about what happened in 2020 with the office shutdowns, and you repurposed a lot of empty corporate space into a consolidated care hub. How did the crisis-driven adaptation redefine ServeRx's relationship with local
that was
providers?
a really interesting time for everybody, right? During the pandemic and uncertainty of how we were going to move forward as a company, just like a lot of companies. We had about 60 employees all in our headquarters in just north of downtown Phoenix. We had just moved into our new office space the fall of 2019, got in, late August, September-ish, just getting settled in. And then all of a sudden we're sending all of our employees home in the spring of 2020, right, to work remotely and figure out all of the logistics of doing that. A lot of our employees are call center employees. And so it was a lot of, setting up voice over IP and getting people all set up to be able to do their call center responsibilities for help desk and verifications departments remotely. So now we had all of this space with a long-term lease, and it was just sitting there vacant. And so we were kind of riding out our lease and looking for other properties that would be more appropriate for just some administrative staff and just the executives, because we were just going to allow our employees to continue to work remotely. And as we started looking at these different spaces that would work for us, it was really a lot of warehouse type space that just wasn't as I guess it just wasn't as luxurious as what we had there in this big space on the 10th floor of a high rise in North Phoenix. And we have expanded into other services, fulfillment for a white glove concierge service for injured workers. So we had, pharmacy fulfillment, and that pharmacy services was up in Scottsdale. And then we also had a toxicology lab clear out in Texas, that in our industry with workers' compensation, if a patient is going to be on a medication for a long period of time, you've got to occasionally do some toxicology for on those patients to make sure that they're utilizing the proper medications correctly, and it helps them with their eligibility to continue to be on the workers' compensation program. So as we were looking to leave, our landlord came to us and said, "Hey, you're the only healthcare in the building. We kind of like having you here. What would it take to keep you here?" And we're in this office building that's full of a bunch of mostly attorneys, a few bankers, but mostly attorneys, and we really like having a healthcare presence here. So they made us an offer that was as good as what we were looking at in these B spaces, and we consolidated. We shut down the lab in Texas, moved it out to Phoenix. We moved all of our pharmacy fulfillment up to that floor now, and reconfigured some things. And so it's really an awesome opportunity now to have everything under one roof, and be able to have really have a much closer, your fingers in the operations of everything that's going on with our business today.
You've cited Wayne Gretzky's skate where the puck is going philosophy. How does this apply to training pharmacists in preventative care while maintaining their medication expertise?
Yeah, like you, I've spent some time in Canada, and that's really kind of the national sport up there, hockey, right? And so as a little kid, I was a Pee Wee League player, and I loved it because you were indestructible when you had all those pads on. The pads weighed more than the kid, it seemed like, and it was fun time. But yeah, one of my all-time favorites has been Wayne Gretzky over the years. And in an interview, he was asked, what made him such a great player, and that statement, his answer, has stuck with me for, I don't know, 50 years or so. And it's that he skates to where the puck is going and not where it's been. And that's the same attitude we need in community pharmacy. We need to go where the profits are going, not where they've been. And unfortunately, too many community pharmacies here in the United States continue to just rely on dispensing medications. Well, Dave, today the profit margin on just dispensing is only 3 to 5%. So those days of the 35, 36% profit margins are gone. And so if you continue to just focus on dispensing medication, you're going to go out of business, which unfortunately about 3,000 independent pharmacies have gone out of business since the pandemic.
Wow. Your More Profit Roundtable podcast focuses on bypassing pharmacy benefit managers through clinical services. What surprising alliances, perhaps with doctors and labs, have emerged from these conversations that you're having?
Yeah, I've been preaching to community pharmacies for a couple of years now on my podcast that they need to expand their scope of services. They need to look outside of just doing dispensing and a few front end products. But the roundtable has been super successful in introducing new products and new technologies for pharmacies too. Amazing things like the very first clinical drink. It's everything you would get in an intravenous IV now in drinkable. You can drink it. The only difference is it takes about 15 minutes to go through your system to hit your bloodstream instead of immediately right into your bloodstream, which you would get with an intravenous IV. So cool technologies and products like that have been introduced, but in really trying to help pharmacies think outside of the box and get in more involved in clinical solutions, does a couple of things, right? It fills care gaps. So David, we here in the United States, we have a shortage of primary care providers. I know it's a little different system up in Canada, but you have a shortage of doctors too. But here, to get in to see a doctor for a well care visit, it may take you several months. to get in, because we have a shortage of doctors, and the doctors we do have are too busy treating sick patients. So they don't have time to worry about, wellness visits and screenings. And so unfortunately there's some care gaps there. And so really looking at, patient outcomes, improving patient outcomes, preventing illnesses, preventing sickness was really where the focus was. But there were a lot of my pharmacy partners that were early adopters to this and wanting to try to get involved in more clinical solutions. But I can assure you there's more wrong ways to do it than right ways. And many of them were getting stuck. They were spending thousands and thousands of dollars to try to get credentialed into the networks of the payers on the medical side. They were, spending thousands to try to get everything set up for doing clinical visits, and still not getting across the finish line. And then I did have a couple of pharmacy partners that were successful in getting into the payer networks. They started, services and couldn't get paid on those services. So there was, problems all around. And I mentioned that problem to a healthcare consultant that I knew, and he said, I think you need to meet someone. And so he introduced me to a gentleman that was, a healthcare IT expert for 20 years. He'd been doing all the integrations for all the EHR, EMR systems. He's built the back end systems for, state health funds like state of New York and others, and spent 16 years with CMS, so our Medicare Medicaid program. He actually helped develop the quality measurement scores that are used today, that doctors are scored by today on preventative services. So he knew where all those care gaps were. He knew what was being missed on wellness checkups and screenings like diabetes and heart health and osteoporosis and everything. And he had actually built a system for doctors to be able to do more of fill more of those care gaps until he met me. And then I was like, hey, our pharmacies need this. Our pharmacies need your program. They need your platform. And so a 180-degree shift was made, and the focus was now all put on helping the pharmacy fill these care gaps in partnering with the local doctors. So it's not taking the attribution away from the doctor. The doctor still manages the care plan of each of their patients, but now the community pharmacy can become an extension to that doctor to fill those care gaps, to make sure that patients are getting all of the screenings that are needed.
When we last spoke, you mentioned that pharmacists are being more trusted now than physicians in communities. How does this trust factor into your care collaboration model success?
Yeah, it's a beautiful thing, right? Especially in rural communities, because the community pharmacy quite often is the health hub for that community. They might have to actually travel to the next town over, or the next bigger city to get to, a primary care provider. But the community pharmacist kind of becomes consultant to them. And you hear all of the stories about somebody coming in to the pharmacist, and they're also very accessible, right, David, because they're there behind the bench working, and somebody can just walk in and ask to talk to the owner or the pharmacist on duty. But they'll come in with cuts and scrapes and say, hey, do you think this is bad enough for stitches? Do I need to go to the ER, or can you fix me up? And so those are already happening in rural communities. But according to Gallup polls and other NABP polls, pharmacists have been, for the last 10 or 12 years, running one of the most trusted healthcare professionals in the industry, even in the larger cities, but specifically in rural areas. The pharmacist is the go-to. And David, there's a lot of things that pharmacists were doing already that would fall under clinical. Let's just take continuous glucose monitoring for example. So you see a lot of people wearing those little things on the back of their arm, that the little monitor, that regularly tests their blood sugar, and no one knows how to wear it, to until you need it, right? No one knows how to review the data that it's putting off, or where the data is going to show up at. So all these pharmacists are already doing those instructions with their patients. Here's how you wear it. Here's how you're going to get your data download. What does that data mean? They're evaluating the data with them. Those are all clinical services that they're not getting compensated for today until now. So now they can actually be compensated for their services. Or think about one of the very first clinical solutions that pharmacists have been offering, and they've been offering this for years, is vaccines, flu shots,
Mm-hmm.
COVID shots, whatever the shingles, all these different vaccinations that are now available at the pharmacy. Well, it's so much more convenient for me to walk into my pharmacist and get a flu shot than to try to schedule an appointment and go see the doctor. And so that was one of the very first clinical things that was brought into community pharmacies. But they were missing an opportunity to do a well care visit. They were still going through, do you
Right.
have any drug interactions? They're asking all the same questions. They're doing everything that a doctor would do before you get that shot, but they weren't getting compensated for that wellness visit. And so now a pharmacy today has the opportunity to turn a $20 flu shot into a $20 plus $85 wellness visit.
Great example. Great example. And it's a natural segue to my last question. So, if you could instill one leadership lesson from your experience in the oil and healthcare industries into every pharmacy owner, what would it be?
Yeah, there's a couple of things, David, that stick with me. One of my mottos has always been follow up, follow through, and our pharmacy partners are amazing. Some of the smartest people I've ever worked with, highly educated, very detail oriented, and they know that follow through. They know exactly what has to be done, step by step by step, and in order to be successful. The other, I guess the other thing that has really stuck with me is that you have to be able to adapt. You got to be able to adapt to the situation you're in, and the um, going from oil to healthcare was a huge adaptation for me, right? And so pharmacists need to be able to adapt to and realize that they need to expand their scope of services in order to stay alive in the current industry. So by adopting additional, clinical services, by getting help in how to set up their programs so that they don't fail like so many have done previously.
Breck, thank you very much for sharing your insights on this podcast, and I hope to welcome you back in the not too distant future. Wish you the best in your business endeavors, and thank you again.
Yeah, thank you, David. It's been a pleasure.